Margaret Muhanga, the State Minister of Health in charge of primary health care, came to launch the construction of satellite laboratory at Fort Portal Regional Referral Hospital. She learned with shock that the new computed tomography scan machine has never been operated. The computed tomography scan operator has never been hired 6 months since the machine was installed.
This in modern laboratory technicians. So you find we have old school people that may not even work on our equipment. And that's why you had the director say that we have a CT scan, we are building for it, but we don't even have a radiologist to run it. You know, now you have the equipment, you don't have the person. Now by the time you get the person, the equipment is becoming obsolete. So you throw it away, all that money wasted.
According to Dr. Richard Bukahi, the Assistant Commissioner in charge of Reproductive and Infant Health at the Ministry of Health, from the time the machine was installed, the ministry has been looking to hire a radiologist, but they have failed to find one willing to work in Fort Portal Regional Referral Hospital.
We are looking for someone to work in the radiology, a radiologist trained with an MBCHB and a master's in radiology. That is supposed to be the head of this unit. Director probably has even the money. So there are some positions that are available here, but there are no people to fill them.
Records from the Ministry of Health indicate that Uganda has only 48 radiologists to serve over 40 million people, and 11 of these radiologists are retired. Dr. Alex Sadaku, the director of Fort Portal Regional Referral Hospital, said that they have trained in-house radiographers to operate the computed tomography scan machine, but they still lack the deeper capacity and expertise to interpret the images from the machine.
Our radiographers have been trained to operate this machine, able to use it, take images. But the capability, deeper capability of interpreting the images that come out of the CT scan is usually done and the report written by the radiologist. A cadre that we don't have. But on a good note for us as a regional referral hospital, we have sent 2 of our doctors for training. I think by next year they will be finishing the course and they'll be back with us here as radiologists.
According to Adaku, the hospital does not have specialists such as radiologists, pathologists, surgeons, cardiologists, neurologists, obstetricians, among others. He added that the hospital also needs better equipment to replace the existing old, worn-out machines and more radiographers to handle the high patient numbers from across the Rwenzori region and beyond as far as DRC. Margaret Muhanga, the State Minister of Health in charge of primary health care, says the limited number of specialists in regional referral hospitals remains a big challenge to the ministry.
Parents who are here, please give career guidance to your children. And instead of going to university to study psychology and come out with a degree, they would rather be medical assistants. Because they have a skill. When you have a degree in psychology, sociology, social sciences, and hear what, you have no skill. Dr. Musinguzi is there. Dr. David, my son, is there. He's a doctor. He can't float. He will find a job. He will find his feet. But when we send our children to study things that have no skill, we are really doing a disservice to them.
The computed tomography scan machine can detect bone and joint problems such as complex bone fractures and tumors. It is also critical in the diagnosis of head injuries, and the procedure costs more than 400,000 shillings in private facilities, but it is free in government facilities. The computed tomography scan machine can also detect complications such as cancer,